H. pylori Heliobacter pylori, pronounced Hel-ee-koh-BAK-ter Pie-LORE-ee, is a type of bacteria that infects your stomach. It can damage the tissue in your stomach and the first part of your small intestine, the duodenum. This can cause redness and soreness, inflammation. In some cases, it can also cause painful sores, called peptic ulcers, in your upper digestive tract. H. pylori is common. Many people have it. Most people who have it won't get ulcers or show any symptoms, but it is a main cause of ulcers. H. pylori attacks the lining that protects your stomach. The bacteria makes an enzyme called urease. This enzyme makes your stomach acids less acidic, neutralizes them. This weakens your stomach's lining. Your stomach cells then have greater risk of being hurt by acid and pepsin, strong digestive fluids that can lead to sores or ulcers in your stomach or duodenum. The H. pylori bacteria can also stick to stomach cells. Your stomach can't protect itself very well. The area gets red and swollen, inflamed. H. pylori can also get the stomach to make more acid. Health experts don't fully understand how. Health experts don't know for sure how H. pylori infection is spread. They believe the germs can be passed from person to person by mouth, such as by kissing. It may also be passed by having contact with vomit or stool. This may happen if you 1. Eat food that was not cleaned or cooked in a safe way. To drink water that is infected with the bacteria. You may be at greater risk for H. pylori infection because of 1. Your age. Over half the people in the US with the bacteria are over 50 years old. 2. Your race or ethnicity. Almost half of all African Americans have the bacteria. 4. People who come to the US from developing countries. At least 50% of Latinos and 50% of people from Eastern Europe have H. pylori. Your healthcare provider will look at your past health and give you a physical exam. He or she may also use other tests, including 1. Blood tests. These check for infection-fighting cells, antibodies that mean you have the bacteria. 2. Stool culture. This looks for any abnormal bacteria in your digestive tract that may cause diarrhea and other problems. A small stool sample is collected and sent to a lab. In 2 or 3 days, the test will show if you have any abnormal bacteria. 3. Breath tests. These can check if there is any carbon after you swallow a urea pill. That is, carbon molecules. If carbon is found, that means that H. pylori has made the enzyme urease. This enzyme makes your stomach acids less acidic, neutralizes them. It weakens your stomach's mucus lining. 1. Carbo vegetable. To Calcarea carbonica. 3. Nux vomica for nitric acid. 5. Phosphorus.